Welcome to Aesthetic TV. I'm Stuart Brazell, coming to you live from the stage of the Aesthetic Show. Now, it happens all the time. You see a vibrant looking person and you assume how old they are by the appearance of their face. Then they reach out to shake your hand and suddenly you realize the appearance of their hand does not match the youthfulness of their face. Their hands have given away their age. While this isn't a new problem, a recent study suggests that people are paying closer attention to the aesthetic appearance of their hands, especially those who have had facial rejuvenation procedures like dermal filler treatments. Dermal fillers have long been known for rejuvenating the face, but a new filler treatment has just emerged that can also improve the appearance of your hands. It's a name you recognize, but with a whole new indication. Radiesse for Hands from Merz Aesthetics is the first and only dermal filler FDA approved to restore volume in the hands. Joining me today to talk about this exciting development is Dr. Alexander Rivkin, a Los Angeles-based cosmetic surgeon and an international authority on non-surgical cosmetic treatments. Welcome to Aesthetic TV.
Thanks very much, Stuart.
Okay, so this is big news. We now have a filler that can be used in the back of hands.
Radiesse is actually the only dermal filler on the market that's FDA approved to treat volume loss in the back of the hands. It's safe, it's effective, and it's a great treatment.
I really look forward to getting into more of the specifics about this treatment, but before we do, why do you think we're seeing an increased interest in aesthetic treatment for hands?
To put it simply, people are realizing that their hands don't match their face.
So what do you mean by that?
Well, we've got a large number of patients. They've seen great results from aesthetic treatments in their face. The face looks smoother, more youthful, but the problem is the hands don't lie. And every day you do things like brush your hair, hold a cup of coffee. It draws attention to your hands. And when they look older than the face, it looks strange.
So in essence, their hands are giving away their age.
Exactly. And that's why it's great for a product like Radiesse for the hands to become available to patients now.
So what happens to our hands that requires this treatment in the first place?
As we get older, there's multiple factors that happen with aging. Components of our skin naturally begin to break down. Environmental factors can accelerate this process. We lose volume in our hands as well. And that's a genetic thing which can leave skin looking thin and wrinkled as the support for the skin underneath collapses, giving the hand a hollowed look and also revealing ligaments and veins that aren't as attractive as we want them to be.
So what can be done to improve the appearance of hands?
Well, Radiesse for the hands provides a treatment option that up to this point really has been lacking in aesthetics. Radiesse immediately restores lost volume to the dorsum, it's back of the hand here, which can really help reduce the prominence of tendons and veins and smooth over the contours of the hand. It also delivers smooth, natural-looking results. It can last up to 1 year in many patients. Radiesse is also unique in that it not only provides immediate volume and correction, but it continues to work by stimulating the body to produce its own natural collagen. And that's really important because your own natural collagen then continues to work even after the product is gone for some period of time.
I understand that as far as satisfaction is concerned, 98% of Radiesse patients receiving treatment in their hands reported an improved appearance after 3 months and more than 86% after 12 months.
Yes, exactly. Patients are satisfied, and this is the same product that's been approved for softening the appearance of wrinkles and folds in the face for almost a decade. Millions of people have been safely treated with Radiesse in more than 60 countries, including the US, since 2006. As with all dermal fillers, though, there can be side effects, which may include swelling, redness, bruising, pain, itching, and nodules and bumps.
Who are the typical candidates for Radiesse for hands?
So the ideal candidate for Radiesse of the hands is someone who has volume loss in the hands and who is bothered by that, but doesn't have extreme volume loss or extreme thinning of the skin. So somebody who has some moderate volume loss, we can really correct well and really make a soft contour to the hands that looks great.
Now, how long does a treatment take?
This is a quick procedure. Usually be completed about 10 minutes. We evaluate the treatment area initially, and then we inject Radiesse through a fine needle, place it under the skin, usually multiple injection points, and make it very precise injections so that everything is nice and smooth. But it works immediately to treat volume loss in the hands, We usually follow the injections with gentle massage to make sure that the product gets very smoothly around those tendons and vessels, so it's a good contour. So the correction is immediate and the results last up to a year.
How soon after treatment can patients resume their daily activities?
We tell the patient that they should minimize strenuous activity as well as exposure of the treated area to extensive sun or heat exposure for about 24 hours after the treatment and until any initial swelling and redness has resolved.
Speaking of treatment, when we return, I would like to welcome Florencia, a prospective patient who is looking for ways to correct volume loss in her face and hands. Florencia is here today to have a quick consultation with you, Dr. Rivkin. Welcome to Aesthetic TV.
Thank you, it's nice to be here.
So she would like to find out what can be done to improve the aesthetic appearance of her face and hands. Dr. Rivkin, what is your professional opinion?
Well, let's take a look. Well, Florencia is obviously beautiful. Over the years, she's had some volume loss over here and over here in their lower face, and Radiesse is indicated for the lower face. And so if we refill that volume, we can really make her look refreshed, and that'll be really nice. Let's take a look at her hands as well. So with her hands, it's the same kind of story. A little bit of volume loss in her hands. If we can replenish that volume loss, we can really smooth out the contour of her hands and make them look refreshed.
So doctor, do you think she's a good candidate?
I think she's an excellent candidate for Radiesse, both for the hands as well as for the face. I think you'd be very happy with the results of the procedure.
I think so. You know, I just turned 52, and I know I don't look the same, but I want to look, I have to have a refreshed look in my face as well as in my hands. So I'm looking forward for it, Dr. Rivkin.
Well, we really appreciate you coming by and talking with Dr. Rivkin about your face and hands. And of course, we thank you for your expert opinion, Dr. Rivkin. Well, we look forward to seeing your results from Radiesse.
So as you can see from the before and after pictures, we've replenished the volume loss of her face as well as her hands. The contours are smoother. It's a great result.
For Aesthetic TV, I'm Stuart Brazell. Stay tuned and stay beautiful.